Again, our sincere apologies for coming late, but you would understand that we are in very difficult times, and there was so much to cover this morning. However, I welcome you to the national briefing by the Presidential Task Force on COVID-19 for Friday, 15th May 2020. When the COVID-19 pandemic was declared, corporate bodies, development partners, individual groups, religious bodies rose up massively to make donations in cash and in kind. For effective coordination and accountability, the Office of the Accountant General published 5 bank accounts into which donations could be paid and swept into the Central Bank TSA account on a daily basis. Consistent with the open government policy driven by transparency and accountability of Muhammadu Buhari's administration, the Presidential Task Force promised that details of all cash donations would be publicly provided. I'm pleased to report that the Office of the Accountant General has published the details of inflow into the federal government COVID-19 eradication support account. As at 14th May 2020, the sum of 792,121,613 naira 89 kobo has been credited into the TSA account from the various in-country sources. I particularly want to commend the sacrifice of some ordinary Nigerians, typified by the donations as low as 1 naira, which for us comes from the purest of hearts. As we progress in our battle against COVID-19, the Presidential Task Force wishes to extend its appreciation to several other groups that have been supportive in the discharge of its mandate. We must recognize the support of the Nigerian police as the lead agency leading the armed forces, the intelligence community made up of the DSS, the NIA, the CDI, and the paramilitary services in maintaining security, carrying out enforcement, and staying in the front lines always. I also wish to appreciate the Nigerian Air Force for providing the airlift logistics that has made it easy for surveillance and surge support mobilization by the Presidential Task Force and the Nigerian Center for Disease Control, even at very short notice. Mention must also be made of the offer by the Lagos chapter of the Federation of Tourism Association of Nigeria to make hotels available to the Lagos state government for use as isolation centers. Similarly, we recognize some airlines such as Dana, Aero Contractors, and Bristol Helicopters who have offered to provide support for the movement of logistics and supplies. This morning, the Presidential Task Force held consultations with the United Nations Resident and Humanitarian Coordinator and his team to strengthen our coordination efforts with the United Nations system in Nigeria and building especially on their global reach in all aspects of the fight against the pandemic, from the scientific, humanitarian, and through supply chain management in the recovery plans. The Presidential Task Force congratulates and appreciates the testimonies of Nigerians who have recovered from COVID-19, which has given us more insight and further strengthens the need to adhere strictly to guidelines issued. However, an emerging issue from all these testimonies is the issue of prescription for treatments. We should always remember that the symptoms of COVID-19 mimic some illnesses we already know, but treating the symptoms is not the same as treating the virus. And for this reason, we strongly discourage self-medication. We shall continue to encourage all Nigerians that feel the symptoms to test, and if positive, go into the isolation centers for care by experts, as we have received from the different persons that have testified. They first tested. When they were confirmed positive, they went into isolation centers and received care. We still discourage management of this infectious disease by private hospitals, except they have received accreditation due to the risk of infection. On the issue of drugs for cure, I am pleased to inform you that 5 states in Nigeria are participating in the ongoing WHO Coordinated Solidarity Trial. At the end of this, relevant health authorities will make statements on acceptable drugs for treating COVID-19. Ladies and gentlemen, for some time now, public discussion has centered on the need to look inward for local cure. Particularly, the social media has been awash with various claims for treatment of COVID-19 using local herbs. The Presidential Task Force remains firmly supportive of the development for a cure for this disease. However, we must follow laid down protocols. The National Coordinator has been mandated to publish some of these guidelines for public consumption. I do hope this will shift the conversation to the laboratories while we await results for the greater good of the nation. As additional information, I am pleased to inform you that the WHO recently coordinated a virtual meeting from 70 traditional medicine experts from countries across Africa to re-emphasize the recognition of the potency of traditional cure. In providing leadership for the fight against this pandemic, Mr. President did encourage state governments to adopt national guidelines as suitable to their states and expect that such adaptation should be informed by empirical evidence of progress made. The Presidential Task Force therefore urges states that are lifting restrictions which allow for large congregations of people to weigh their consequences in relation to creating opportunities for more seeding of the virus, thereby negating gains already made. The Presidential Task Force has received media reports about an extrapolated level of prevalence of COVID-19 in Kano, based on the number of some foreign nationals that have been evacuated from Nigeria. The Presidential Task Force team of experts are still on ground in Kano and are working round the clock alongside the teams from the state based on scientific and statistical analysis. I urge members of the public to remain vigilant and seek authoritative information from the public health authorities at all times. We have also noticed a marked reduction in the delivery of non-COVID-19 related services in our hospitals. You will recall that the Honorable Minister of Health had on several occasions implored our health institutions not to jeopardize offering critical health services to patients who require attention. The Presidential Task Force wishes to reiterate this call and request that health service providers should help relieve the burden of the disease in the country by offering required services. As at present records show that we may be experiencing more unnecessary death because our hospitals are turning back non-COVID-19 related patients. As we continue the countdown to the end of the first phase of eased lockdown approved by the President, the centrality of coordination, especially with the citizens, become very imperative. Our national response has always been guided by the science of the pandemic, as well the extent to which applied measures are helping to contain the virus without compromising basic elements of life sustenance. Going forward, science and statistics shall play major roles in the decisions to be taken. Similarly, community engagement shall become a strategy of focus for the Presidential Task Force. Finally, let me say that our preliminary analysis has narrowed down the over 51% of the total number of infected persons to 9 local governments across the country, and all of them are densely populated. This indicates that a critical element of our timing of the pandemic is to reduce opportunities for large gatherings, sustaining the ban on interstate movement, the nationwide curfew, and complying with the measures prescribed, washing of hands as frequently as necessary, use hand sanitizers, maintain social and physical distancing, use a face mask or covering in public places. In the coming days, the Presidential Task Force shall submit its recommendation to the President for consideration. Until a decision is announced, we advise you to please, if necessary, stay at home and stay safe. I now call on the Honorable Minister of Health, followed by the DG, Nigeria Center for Disease Control, and the National Coordinator to give you the necessary updates. And I thank you for listening.